I'm Jerry Hesch, and this is a concluding visit with Jordan, and this is his third visit. We saw him on the 17th of December, and then less than a week after that, and he comes back, and his gait is normal. Pain level is, his pain is basically gone. He's had a little bit of soreness in his back from sleeping on the sofa, but that abates very readily. He has not had the familiar low back pain that he had previously. He's no longer using his cane. He's very optimistic and very anxious to get back to playing sports such as football. And due to this injury, he was being homeschooled, and his mother has made arrangements for him to return to regular school, which he and she are very happy about. I'm saying too many times. I screened his low back and SI joints, and everything is normal. His strength in all of his trunk muscles, hip extensors, abductors, etc., all grades 5 out of 5 strength. So there's no treatment today. I answered questions, didn't have any questions. Talked about future care if he should have a similar injury, though I don't think that it's going to happen. So I'm going to film him now, just demonstrate his gait, and then I will film his father, just describing his benefit. And to summarize, he had a classical downslip of the right ilium, which is a form of sacroiliac joint dysfunction. And a downslip is the most painful type that you could have because it contracts on the sciatic nerve. He did have some abdominal pain. We haven't not been able to discern what that was. It can be referred from the front of the SI joint, and that most likely is what that was. There's a point there called Bayer's point, which is a tender point. You can also have iliopsoas pain, which will be in the front of the abdominal wall. But when I saw him, he was not having any abdominal pain, so we don't know exactly what the source of that was. So on YouTube, we have a video in which I talk about upslip and downslip, and I contrast the fact that a downslip can appear to be an upslip because a downslip is a downsliding of the ilium on the sacrum. But the trunk muscles, especially the quadratus lumborum and the oblique muscles, try to pull up the pelvis because it's painful, protect it. And so the clinician can look and say, oh, the pelvis looks elevated. But in truth, one of the most important tests you can do, there's actually two of them. And one is the passive spring test that I've talked about in a previous video, and also palpating the sacrotuberous ligament. Because when the ilium slides down, that ligament will be very, very tight. It'll feel like bone. And when you try and spring the ilium back up passively, it will not spring up because it's stuck inferiorly. So the passive motion tests, called spring tests or springing with awareness, are very important in making the discernment between a true upslip and a true downslip. And an upslip usually is not painful. It's certainly not as painful as what he experienced. That should have been one clue. But he did have therapy in Indianapolis, and the clinician thought he had an upslip, treated it as such, and actually made him worse. Well-intentioned person, but just didn't do enough detailed testing. So let's take a look at how he walks. Thank you. Okay, Jordan, take off. And that's so different than when he walked in. He walked in with a, he's covering his face. That's okay. I'm not filming your face, okay? He walked in using a cane and moving the cane in front of him and then bunny hopping with both feet. This is certainly a dramatic difference. So I'll briefly film his father and have his father describe the experience.
Well, it's been a very good experience, actually. Like Dr. Jerry said, that he walked in here, he was bunny hopping with his cane. After that very first visit, he had him walking without that cane. Still in a lot of pain, but obviously he was walking without that cane. This is our third visit here. The second visit, he was pretty much completely had this issue resolved, and almost walking back to normal. So he still had a little pain after the second visit, which was probably an obvious thing, or I won't say an obvious thing, but it's going to take a little bit of time to get over the pain. But He's actually pretty much, I would say, 99.9% back to normal now.
Can you describe his life in the last year in
Um,
general, just briefly?
Well, since he doesn't live with me, he lives with his mother in Indianapolis. He very active in sports: baseball, football, basketball, golf. Over the last several months, since this problem's been a persistent problem, he's hasn't been able to really walk, hasn't been able to sit up, lay down. From the experience or the explanations from his mother, stating the fact that he was just in so much pain that he couldn't hardly even move. And I credit her with all the research she did on the internet to find Dr. Jerry here. And
PT, physical
I'm
therapist.
sorry, you're a doctor to me.
We take offense when you call it doctor.
Okay, physical therapist. But very encouraged that he's out here, and I just happen to live here now, and we got him sent out here to get him treated. And like I said, after basically 2 visits, he was.
It was certainly fortuitous. You just happen to live here in Las Vegas, and I'm in Henderson, which is, seamlessly connected to Vegas. You really don't know when you leave Henderson and enter Vegas proper. So it was just fortuitous that he was coming here. He didn't fly out to see me. He flew out to...
Well, actually, he had no intentions of coming out here.
Oh, is that right?
No, he
I
did
see.
not. He wasn't coming out for the holidays. Just
Oh,
his sister was, because he wasn't able to travel.
Got it. That's right.
Because of the pain threshold he was
Yeah.
involved with. So
Yes.
when we found out that you were out here,
Then it worked.
Had it set up that we'd go ahead and give it a shot, have him travel out here and
Okay,
see what he could.
Jordan, you owe me for this vacation. You owe me big.
I want a candy bar.
A candy bar. Well, think big. You're thinking like a child. You're thinking like a kid. Think adult. Like, what would be good for an adult?
I'll
All right.
king size it.
King size it. You're a generous child.
I-
You're generous there. You went from what, 89 cents to what, $1.29 or on that?
19 probably.
Yeah. Okay, Mr. Generous. Anyway, I'm really pleased. I think that this will, continue to do just fine. And it certainly was a frustrating process of diagnosis, wasn't it? I mean, he did see an orthopedic pediatric orthopedist, and he did get a workup for the abdominal pain, but that, of course, was negative, and an MRI and a CAT scan and an X-ray and
There
physical.
was a lot of testing involved. A lot of testing that
Yeah.
his mother, was pulling her hair out over, trying
Yeah.
to get him diagnosed, figure out what was going on.
Yeah.
And, she was basically at her wit's ends. And, like I said, it just so happened that she saw your website.
Yeah.
Was able
What
to
happened was the
contact you.
therapist that treated her for the upslip was using some of my techniques, and he did take a
Okay.
workshop. And so she was talking to, as I understand it, he was talking to the therapist's wife, and she said, well, since he's been using the Hesch method, he's had some nice results and blah, blah, blah. And so that's what cued her to research the Hesch method. So it was kind of serendipitous, that they had that conversation. And it's good that she, in spite of it hurting him, that she still looked into the technique, hoping that there was more to it. Some people just run the other direction if something, hurts them rather than, go forward, if you understand what I'm saying. But again, he was homeschooled simply because he couldn't tolerate, walking in
Right.
school and such.
Well, they even considered a wheelchair at one time.
Yeah. But
we
the
went
sitting
to
was
private
just
school.
sitting was just not tolerated at all, was it?
Right. Was not.
Yeah.
So.
So anyway, it's a nice story with a good ending, and so I think we'll just stop right here. Thank you very much.